Duchenne is a very rare genetic disorder. It affects roughly 1 in every 20,000 to 50,000 newborns. Duchenne syndrome is present from the birth of the child and affects growth and development. Most cases of Duchenne happen sporadically when during the development of your parent's sperm or egg, a piece of genetic material on the P arm of chromosome 5 goes missing. This is called deletion. Duchenne deletion occurs specifically after the deletion of human telomerase reverse transcription, which helps to keep the information in DNA functioning properly. It also occurs after the deletion of the catenin protein. Catenin comprises of a group of proteins that play crucial roles in embryonic development and adult tissue homeostasis. Very few cases of Duchenne are inherited. In 80% of the cases, the chromosome-carrying deletion is from the father's sperm rather than the mother's egg. Risk factors for Duchenne include symptoms of Duchenne include a cat-like cry during infancy, which is what the syndrome is named for, and low birth weight, small head size, this is known as microphthalate, speech delay, heart defects, and trouble breathing. Duchenne is diagnosed through clinical evaluation, such as watching newborns for symptoms, and or karyotyping of chromosome 5. This karyotyping process is known as fluorescence in situ hybridization, with an acronym of FISH. There is no specific cure or treatment for Duchenne. Treatments for Duchenne depend on the symptoms of the patient. For example, if the patient has poor muscle tone as a result of this syndrome, they would receive physiotherapy. If they have communication issues, they might have speech therapy lessons. The prognosis of Duchenne depends on the severity of the birth defects. Most people with Duchenne live well into adulthood. About 1 in 10 babies born with Duchenne syndrome are severely affected and die within the first year of their life. People with Duchenne generally have developmental disabilities, stunted muscle growth, and cardiological issues, so much of their time will be spent receiving therapy and examinations. Some have communication disabilities resulting in their inability to speak or understand. Many live well into adulthood, although throughout their life they may have to receive lots of assistance. It is common for someone with Duchenne to communicate through sign language. Duchenne syndrome was first described in 1963 by French Doctor Lejeune. He discovered the disorder after observing 3 patients with deletions of short arm of the chromosome 5. Each of these patients had similar symptoms, including high-pitched, monotone cat-like crying during the first years of their life. He named the disorder after this attribute, as Duchenne translates to cat's cry in English.